think people often get confused when we talk about the Icelandic prevention model because in its essence, the prescription is really the process itself. It's not necessarily a certain set of strategies or a certain set of tactics. Often when people talk about the Icelandic prevention model, you hear a lot about leisure time, athletics, you'll hear things about curfew, and all of that was a part of it. But depending upon the community, the strategies that were developed often are very, very different and still have a lot of success.
The vision, a world where all people live free of the burden of drug abuse. This is the Drug-Free America Foundation's Pathway to Prevention podcast, where we are committed to developing strategies that prevent drug use and promote sustained recovery. Thank you for not only tuning in, but your continued support and efforts to help make this world a better place. We hope you enjoy this episode. In this episode, we dive into the fascinating topic of how to improve the well-being of young people in our communities. Our guest, Dr. Michael Mann from Boise State University and a leading expert in youth development, shares insights on how to sustain adult attention and engagement in efforts to support young people. We explore the successful Icelandic model, which has made significant impacts in reducing substance use and misuse and other risky behaviors among young people. Dr. Mann also provides valuable tips on effective data collection and communication strategies, as well as the importance of building strong institutions and partnerships to achieve long-term positive outcomes for young people. So sit back, relax, and enjoy this conversation. All right, podcast listeners, I am excited and honored to welcome Mike to the show. Mike, welcome. Thanks for joining us.
Yeah, thank you so much for having me. I really appreciate it.
Yeah, I've been looking forward to this conversation since our first email exchange, and quite frankly, been having fun talking to you before we even hit that record button. We're going to get into some fascinating stuff. But before we do, would you mind just introducing yourself a little bit about kind of your background and your current role for our listeners?
My name is Mike Mann. I currently work at Boise State University in Idaho. I have a lot of hats on there. For the most part, I'm an associate professor where I teach students who are interested in public health and education. I do research in this space as well, the intersection of public health and public education. I currently have a bunch of administrative assignments where I support people who have that same passion, that same fire, that same mission to do a lot of good in the lives of people in the communities that they live in and serve. I think in terms of the context of this conversation, one thing that's really important to know is that although I'm a researcher now and work as a faculty member at a university, I spent almost 20 years working as a practitioner before that. So the work I do is really heavily informed by the time I spent as a teacher in the alternative school setting, an assistant principal and principal in that setting, and then supporting different alternative schools in other administrative roles. And so I think for me, probably the most important thing about me isn't that I work in a university right now, but it's that I have a long history of working with communities that care about children and want to create the best possible life for them. And that's continued into my research work, but I think that's fundamentally the most important part of my background, and certainly the prime driver of my mission in life.
I dig it. And yes, I think you, me, and all of our podcast listeners feel the same way. We care about the communities we live in, those folks that we live with and we serve. Your research, your work with communities, what do you do?
That's a great question. I think, the thing that connected us was through my work with something called the Icelandic prevention model. And some people may be familiar with it. I feel like over the past 10 years, it's something that has gotten a bit of a global audience. My role in it is actually very, very humble. So I'm going to describe what I think of as the people that are much more important than me. And then I'll tack on a little bit about how I've tried to be a good teammate to them. As many people know, about 20 years ago, Iceland actually had some of the highest substance abuse rates among adolescents in Europe. And I think at that time, they did something really courageous, which was as opposed to trying to use kind of like a Band-Aid type approach. We'll just do these little tiny fixes and kind of cross our fingers and hope they add up to like a society level change. I think they did a really courageous job of stepping back and saying, how do we maybe change our systems and our overall approaches in a manner that's likely to create the kind of world we want our young people to grow up in. And in most cases, that meant having some pretty kind of ambitious goals, some really, I think, courageous aspirations for how things could be different. That work started with a wide range of people. So some of the kind of core drivers of that would be Inga Dora, for instance, who has spoken all over the world about her role in bringing kind of a really deep sociological perspective to this to work. Oftentimes, addictions work, we kind of come at it from a psychological perspective, a more individual-oriented perspective. And she brought this sense of that often people are a reflection of the communities that they grow up in. And as a result, how do we think about how we not treat individuals only, but instead really think of society as a patient and think about what societies need and how we need to make changes in how society is structured and how we limit exposure to risk for young people and maximize exposure to protective factors. And in doing so, create the kind of opportunity-rich, safe, secure environments in which young people can grow up and thrive. And so with her leadership, and then really one of her great talents is connecting people across all kinds of different sectors. And I can name a million people. We can talk about Margaret. We can talk about Gisli. We can talk about Jon, all these amazing people who were leaders in their own right and leading their sectors and working together to kind of build this kind of community. And so over the course of 20 years, they went from having some of the highest rates of substance abuse among teenagers in Europe to the absolute lowest rates. And so from my point of view, they successfully treated society as a patient and have created these really great environments for young people in which them thriving is easy. My role about 10 years ago, me and Alfgeir Christensen were hired into the same School of Public Health as assistant professors. We started swinging kettlebells together, which clearly he does more than me. If you've met us both, I am shaped like a kettlebell and his biceps, I think, have kettlebells in them. But through our common time working out and just talking, we realized that we had a lot of similarities in how my alternative schools operated in terms of community and their community building, which has worked. And then started trying to ferret out exactly, at the time, a lot of this model grew very organically. I mean, it had deep theoretical roots. So I don't want to take away from that. It was very purposeful and intentional. But I think a lot of the operational details, as often happens, kind of organically rose up over time. I think there were some amazingly smart people who recognized what was working and doubled down on those things, and they recognized what wasn't working and they ignored those things and eventually kind of created this pathway that other, I think, communities can use. But kind of part of my role was to be this kind of objective person who could look at what they were doing and talk to them about what they were doing, maybe ask some clarifying questions. And very often Alfgeir and I would talk and he'd say, "Oh, we just did this," like it was nothing. And I'd be like, "What are you talking about? It's amazing. No one does that. That's incredibly special." So I think in a lot of ways, in the beginning, my role was just recognizing the great work of other people and helping them realize that what felt common to them might be really special to some other people. And so then we, worked on writing some articles together and creating what I hope, when I say creating, I mean, other people created it. We worked together to give voice to it and give voice to it in a way that's portable, so that other communities can take those lessons and integrate it into what they do when they try and create these great environments for young people as well. Told you I was long-winded.
You got me thinking about my morning workout. So I've got a gym right next door where I work out in the basement too. So yeah, we are cut of a very similar cloth. Fascinating though. And I would love to dive in a little bit more and unpack the Icelandic model. Can you tell us more? I'm particularly interested in the culture, the society, the environment that they were able to create for the youth to prosper in, the protective factor side of the house. What does that kind of look like?
Yeah, I think, often if you are at a presentation about this and lucky to be talking with Icelanders who are far more articulate and describe this much more beautifully than I do, often they'll show a picture, and the picture is from somewhere around 3 or 4 o'clock in the morning in Iceland. It looks like it's broad daylight because in the summer, the sun goes down a very limited amount of time. This is a picture from the 90s, and it's literally like the main kind of street area just jammed with teenagers. And, this idea that at that time, probably around 25 years ago or so now, that was normal. The idea of being 15 out at 3 o'clock in the morning, having drank all night was just a little bit of a cultural norm. And as often, culture is often described as the things we know that we don't know we know. They're so deeply ingrained in how we see the world that, one of the only ways we recognize them is to see something different somewhere else and think like, that's strange. And then actually it's, maybe that's not, we don't know if that's strange or I'm strange, but like, that's how deeply rooted it is that anything outside of that just feels odd. And so this picture that's famous ended up in the media and really had people reflecting on, is this what we want our norm to be? And I'm going to be really humble in how I speak about this because clearly I wasn't there and clearly I wasn't a leader in this, but I have been able to listen to people talk about this quite a bit. And I wouldn't make like light of this part. I think that, one of the, and this is going to sound harsh and don't mean it to at all, but one of the things when you look at something like public health policy, by the way, I've never heard the Icelanders say what I'm about to say, but if you look at public health policy, you'll often hear this idea that sadly, too often policy gets written in blood, which means something bad has happened. And then people write policy. That the idea of us seeing something bad and acting before it happens is really rare. And so, although in this case, it wasn't that extreme, they did see something that definitely got some people's attention and had them thinking about, they saw an outcome and I think had the wisdom to question whether or not this norm is something that they want to continue and whether or not they wanted to replace it with something better. So I think that was the beginning, this idea of, what event or series of events is enough to initially grab our attention and is convincing enough to us that we're going to make a commitment to do something that we sustain over time. And so I think that was a big beginning part of it. I would also like to say that I think this idea, and in no way am I making any slight to folks who work on the more psychological end of it, that is an important end of it. But I think the deep roots in sociology are also particularly important. This idea that we are often a product of an environment. So if we think about young people, we think about the worlds they live in. We have a family space or family caregiver kind of space. We have a school or education space, and we have a peer space. We have a leisure time or third space, the things we do between school and family. And if we take a look at those 4 kind of areas and we imagine, 4 circles coming together in a Venn diagram and where they overlap, individual young people are often an expression of what's happening in those areas. If we think about leisure time, the leisure time kind of area, if there's not much for kids to do, it's easy to access alcohol and there's lots of places to use it. Guess what kids end up doing? They do what's available to them and what's easy for them to do. And so I think their perspective was, bringing these kind of sociological lenses. How do we create an environment, a social environment, a policy environment, sometimes a physical environment in terms of access and those kinds of things that make it most likely that students are going to turn out well, make good decisions around substance use and making them less vulnerable to abuse. Kind of like one of the classic examples when we think about this is, we can describe a situation in which a young person lives or grows up in a high risk environment with low levels of opportunity, the schools that don't serve them especially well, families that maybe have higher rates of poverty, or, really struggling economies that don't have a lot of opportunities or things for young people to participate in. And we flip all that and say, well, you take another community in which, it's people aren't maybe struggling economically so bad. I mean, I'm not even saying let's make them affluent. Let's just say people have their needs met. They're in good schools. There are things for young people to do that are positive and pro-social. And, what are the chances that you're going to have the young people, the young people growing up, they're going to look like that environment. And we know the chances of that are really, really high. And so this idea of if we want young people to make choices against substance use and that make them less vulnerable to substance abuse, then the kind of environment we ask them to grow up in is really important. And in the spirit of being long-winded, I will add this, often what we'll say is the environment's hard. And so we'll teach young people to be resilient. We'll teach them to swim against the current of the environment that adults have put them in. And I'm not against resilience, but at a fundamental level, and this is controversial, I mean this in the softest, most loving, gentle way possible. From our work, I'm always very hesitant about the idea of asking young people to be better victims of the environment that we put them in, and instead want to ask us as adults to create resilient environments in which the adults have taken responsibility for the situations we put young people in. And instead, we've created an environment in which you would have to kind of go against the grain of all that positive opportunity to make a bad choice or a harmful choice. So I think that's kind of, in a lot of ways, the essence of what they're trying to do. Let's create an environment in which it's very hard to have a bad outcome, and change environments in a way, help environments grow in a manner that reduces the likelihood of young people getting themselves into some trouble. And so, I think that's kind of the cultural roots. How do you shift that thinking to recognizing that there's something happening, that we're accepting something that maybe we don't want to accept, and then in domain by domain, family, school, leisure time, peer, strengthen those domains so that they're operating in a way that, of course, most students are going to end up doing well and they're going to flourish.
So much wisdom there. I'm feeling scatterbrained because, I want to talk about this. I want to talk about that. I want to talk about that. But I think so many things resonated with me, and you probably saw me, podcast listeners. I know you can't see me, but I'm over here nodding. What I see often with coalitions and communities here in the United States is policy programs are so reactionary. Say there was a DUI accident or fatality on a prom night, and there's the reaction based upon an emotional response, albeit very important. We take action. But what I'm hearing is the Icelandic model, they paused and they went through a process to determine what the best action was. So often when we see reactions happen, policy happen here in the States, it's something bad happened. We need a policy. Boom, let's put it out there. Said, let's look at all the objective data. What are some of the positive implications? What might be some of those negative implications? What are some of the opportunities? What is the potential? What new innovative ideas outside the box thinking can we bring into this? And I also feel like they also brought a layer of that critical thinking. Yeah, but what are the implications of not acting, of being successful? And boom, they took action. That's kind of what I was hearing.
Yeah, I think so. And again, I don't want to oversell times that I wasn't there. I will celebrate them strenuously and joyfully because I feel really lucky to be a part of a very small part of the really great work that they've done. I think to me, part of the thing I think is so important about their approach is I think lots of places, as you described, an event happens and then we reassess. So, this picture is taken there, people are looking at it in the media, and there's an opportunity to reassess. I think one thing I love about them is that they took advantage of that opportunity and they actually reassessed. I think we have all kinds of opportunities to reassess. and we whiff on it. We don't do it, or we reassess at a very superficial level. But I think for them, there was a kind of a deep reassessment, and people, kept people focused on that. I think out of that, and this to me is one of the great strengths of this approach, is the idea that, I think things like attention are a treatment. How do we create, a system in which, or a process in which, we're able to sustain adults' attention over time? So, you described it, something terrible happens in the States, people get anxious, we'll have a community meeting, 500 people will show up, we'll have a community meeting 3 months later and 5 people show up. And so how do we sustain attention over time? And when I say that, I'm not being necessarily ugly. People have 1,000 reasons why 90 days they aren't there anymore. I'm not being judgmental about that. But I am saying that in order to make progress, we can't forget the tragedies that we don't want to have happen again. And so we have to have some system. And so in this case, what I think is really helpful, and over time, and again, I think a lot of this developed over time and organically, and people tried this and they tried that and this worked. And although it was definitely based firmly in scientific principles, there is a science to what we need to do, and then there's an art to getting it done. And I think we have people who are really good at both. To me, and I think people often get confused when we talk about the Icelandic prevention model, because in its essence, the prescription is really the process itself. It's not necessarily a certain set of strategies or a certain set of tactics. Often when people talk about the Icelandic prevention model, you hear a lot about leisure time, athletics, you'll hear things about curfew, and all of that was a part of it. But depending upon the community, the strategies that were developed often are very, very different and still have a lot of success. So really, the heart of it is this process of how do we bring people together? How do we collect data that is related to the domains I was talking about in terms of family, school, peers, leisure time? How do we look at a list of risk and protective factors and then do actually some diagnostics in this community, which risk and protective factors in each domain seem to be contributing to the best possible outcomes in the young people in a specific neighborhood, like a catchment area of a school? And then how do we work with people in all the domains we listed to develop some goals around what are one or two things we can do together to strengthen this environment for young people? And so you collect some data, you go through that process of creating some common goals about how we want to strengthen the social environment. You implement those goals. In 1 to 2 years, you give a survey again to see how are we doing? Are things getting better or worse? You look at the risk and protective factors again. What targets are out there that we can see that we can make a good difference? Which of those targets feels the most consonant with this community? One community might say, oh man, it seems like young people whose parents spend a lot of time with their friends' parents, so they've built some social capital. Man, it's really working well. It's reducing rates of use. But one community may have a lot of reasons to say, man, we don't really think, we can set a goal that will be effective there, but the one next door does. That one picks that goal up and the other one picks up a different goal. And so I think this sense of again, there's a process in which we've raised awareness, we've collected data, we've made data-informed decisions in a way that is, create a certain amount of social cohesion, that we as a community are deciding on something we want good for our young people together. We're trying to implement that, and then we collect the data again, get on the scale, see how we've done. Often, and gosh, I feel like everything I'm going to say in this podcast is going to make people mad at me. For those of you who know me, you know how good-hearted I am. I don't mean anything bad about it, but in general, I think in the States at least, a lot of our coalition work around substance use prevention doesn't go anywhere. This, I think, provides a structure that propels community coalition work forward and that holds it accountable, because you're getting this data at regular intervals, which gives you a sense of whether or not you made progress together. It's giving you clear targets through diagnostics that's specific to the community you serve, not just these general scientific principles, which are important, but are really most important in the context of local data that's telling you what works specifically with the young people and the families we're serving. And so I think as you said, the process is the prescription. So it just provides a little bit more structure. I think the other thing that it often does that is so important is part of the goal of this is to say, how can we strengthen the institutions that are dedicated to serving young people? How do we strengthen families? How do we strengthen schools? How do we strengthen after school programs and leisure time opportunities? How do we strengthen social services that are dedicated to serving young people? And so we build these institutions, which hopefully are a reflection of our values. We just say students learning is so important to so many of us that we're going to invest some of our collective resources there. And so I think that part of it too, where we're strengthening institutions over time, we're strengthening relationships over time, we're strengthening our ability just to agree on the obvious things, which is we want our children to be well and to act on that. And so I think this kind of, people often ask, how is this different from traditional kind of coalition work in the US? And in this case, I would say there's a very clear structure. There's a very clear plan. It's very data-based. It combines practitioners and scientists effectively and families effectively. It creates sustained attention over time across all of the parties that really need to be engaged in that. And it strengthens institutions that are dedicated to serving young people. So that's what this does. The thing that I think we often don't do that's in that is we do things like fund work on 1 to 3 year grants, trying to solve social problems that took 1 to 3 decades to create. We often put people in coalitions who, although they are good people, in my experience with them, most of them have dedicated their lives to doing great things in the world, but we ask them to collaborate while also asking them to compete for the next grant. And so that's a huge obstacle to collaboration. If whether or not I'm going to be able to pay for my children's school and my team can maybe pay for a mortgage is at risk because we're doing too much with our neighbor. People will say, no, that doesn't happen. It absolutely happens. I think coalition work often in the States is very, very heavy on planning and not super heavy on getting it done. And that's because doing it is hard. And as opposed to creating strong institutions with the capacity to get it done. I mean, often when I work in the States, we spend enormous amount of time trying to build the capacity to act because we've underinvested in institutions designed to do this good work in communities that need it. And so we try and piece together enough capacity from these 4 different grants until eventually we have it for 18 months until one of the grants is gone. And then we're trying to figure out how to do that next piece. And so I think another thing that can be missed in their good work is just saying, this is something we're going to make a commitment to, and we're going to build, we're going to recognize, one thing we want to talk about is that you want the scope of the solution to match the scope of the problem. And so if this is a generational problem, if it's taken decades to develop, it's probably going to take a while for us to be able to address it appropriately. And how do we build strong institutions able to keep that capacity over time so we can make and sustain progress?
I love it. And what stands out to me that is unique and powerful about the Icelandic model would be a couple things. One being that paradigm, that mindset that society is the patient, and that what I see often here in at least the States is when we look at environmental or individual programs, we tend to skew towards the individual, one, because of funding, but two, this is where I might, frustrate people, but it's easier to get data on that than the environmental strategies, the environmental change is so much harder. And because of the grant structure, you got to have your deliverables, you got to hit your numbers, your get rid of all that. We skew towards those individual, and they are so important. I will push that comprehensive approach till I'm blue in the face, but we shy away from environmental because it's hard.
Yeah, I agree with that. And look, I mean, it's a weird balance. It sounds like we're both trying to kind of like a tightrope we're trying to walk, right? I care very deeply about individual young people. I mean, we can sit here and I can go name. It was funny. A few weeks ago, I was talking to someone I worked with when I very first started working in alternative schools. In any case, like I'm naming kids from when I was 20 years old. Like, oh, do you remember, this person and that person? And just it's so vivid in what I want for their lives. I still feel like in a really deep personal way that's connected to that exact young person. And so, this idea of wanting great things for individuals and knowing that no system is perfect, and that when young people aren't well served by these broader approaches we're talking about, that there will always need to be some kind of individual level treatment options. Absolutely. I just think what we're saying is we want those to be rare in the exception and not what our plan is. If the plan is, well, we create environments that are very difficult to be successful in, and young people are struggling, almost predictably struggling sometimes, and then we try and treat our way out of it. Well, I mean, there's an enormous amount of harm that's done to that individual young person if that's the strategy that we choose. An enormous amount of harm can be done to whole communities that can be ravaged when a large number of their young people struggle and suffer with addiction. And I think in addition to that, then there are people who are, a little more aspirationally or heart driven about these things and just what it means to young people and their families and communities. But even just in terms of the financial models of just how incredibly expensive treatment is, the social cost and the individual cost motivates me. But if you're someone who's motivated by the economic cost, so I think it's easy to make a case that we shouldn't have a model that ignores a problem until it's so massive that it's done terrible amounts of social harm and incurs massive, costs to correct it if we even can. And so, so it's the individuals matter, but I think in terms of being able to reach as many individuals as possible, these social type of interventions are really, really essential. Each life matters immeasurably, but the way to impact the most number of lives isn't necessarily one by one. It's by creating an environment in which most people are going to come out pretty well, and we save and we hopefully limit the amount of harm done to people that we have to respond, to in terms of them being further down the road in terms of the negative consequences they're dealing with. And over a lifetime, I certainly have people in my life that I love who have had issues related to addiction that would absolutely have loved to have never been introduced to the struggles that they have to deal with every day. And there's a huge cost there. So I think we can care about both at the same time, and we can be smart enough to realize that funding one doesn't preclude funding the other. And that in a perfect world, this problem is so small that, that can limit the worst harms as much as possible. I think it's easy for us all to be on board with that.
Yes. And one of the other things that really jumped out at me that just felt powerful and different than what I'm used to here in the States as far as prevention is the focus was to strengthen organizations that serve the young people too. I feel like our go-to is, okay, let's do this program. We've got to go teach this many classes in the schools. We've got to go do this, this, and this. But the way you articulated that, strengthen the organizations that support young people, that also, made my heart feel happy.
Well, I think woven into it too, and you don't want to over idealize something. And I want to, again, be careful not to like speak past, I'm sharing, what I've seen a little bit and what people share with me about their stories. And I don't want to undersell it because I also work a lot in this space with these folks, but I don't want to pretend like I was more significant than I was, especially in the beginning of it, because I wasn't even there. But I think this idea of, building these institutions is important, but I don't want to act like that sustaining them isn't a bit of a battle sometimes. I think anytime you have a massive problem and it seems like you've really gotten your arms around it, of course, are there temptations to say, well, maybe we don't need those resources to go there anymore and we should shift them to something else. Now we know what's likely to happen. You pull those resources and likely, it's the problem of funding prevention forever. How do you demonstrate the value of something that didn't happen? Part of it is showing, well, this is the harm when it was happening. This is what we did to make that harm be dramatically reduced. And then I think we have to, again, be able to sustain enough adult attention over time to be able to realize that if we take away the things that are protecting young people, families, and communities, then there's a great likelihood that we could have problems again. And maybe the magnitude of them are smaller, or maybe they're bigger. We really don't know that, but we do know that if we have certain things in place and they serve people, we keep them in place. And we can use a million examples of this. At some point in my life, home that I lived in caught fire. And, I wake up, I smell burning. I look around, I can't find it. I think I'm crazy. I try and lay back down, but I can't. I just still smell it. I don't know what's going on. And finally I find it. It's outside of my house, and a corner of the house has caught fire. And I call 911, and a fire station somewhere, an alarm goes off. People fill a truck and they come to my house and they save my house. And we understand that keeping that capacity all the time is important, whether or not the house is on fire every hour on the hour, or, we just understand that there's certain things that we keep capacity. There's capacity we keep around our government. There's capacity we keep around self-defense. There's capacity we try and keep to keep community safe. There's capacity we keep around, medicine and the need to intervene medically. I think this idea that we understand that certain things are important enough that we keep capacity is something that we're familiar with, but I think that we struggle with a little bit around the space of children. And somehow, and let's say this, in the States, do we invest heavily in education? I think the answer to that's yes. We do invest a lot of money in education. Are we often constrained in how we use that money, or whether or not enough of it gets to actual teachers and schools and classrooms? Those I think are some challenges, but I think this idea of, how do we build the strongest possible institutions? We've just been through a pandemic. I talk to teachers all the time, and I'm not going to lie, they're tired. And if you ask them how valued they feel right now, at least of the teachers I talk to, they don't feel like they are part of an esteemed institution in which people are grateful for them taking on the sacred trust of trying to help their young people cover their strengths and grow, the most meaningful and opportunity-filled lives possible. They feel, as though they aren't trusted, and as though people will heap limitless demands on them, and that as hard as they try to meet as many of those demands as possible, they're often met with a lack of gratitude. Not even I don't know many teachers that feel like they need a ticker tape parade, but just, a thank you now and then, never hurts anyone. And so how do we strengthen these institutions full of people devoted to serving our young people, and help make sure that as a society, we're treating people as though they're as valuable as they are, and that we're funding their efforts in a way that gives them a chance of achieving the goals that they need to achieve, and that we agree with. And let me say this, because I think this bears repeating, because as I'm talking, I'm definitely a community-oriented person. But I will say this, my community orientation doesn't come from, I'm politically a very hardcore independent. It's certainly not a political agenda anywhere. It's certainly not, having worked, I've worked in, countries that have socialist parties. I've worked in countries that are very, very far to the right. I think people have children across all kinds of political party lines, and all of that means almost nothing to me. Where I learned about the importance of working in community came from honestly growing up in the South in the United States of America. My family's originally from Alabama. I spent most of my formative years in Florida, and, it was my grandmother and my mother that taught me things about being a good neighbor, and, treating people how I wanted to be treated myself, and being able to recognize when we were on the same page, being able to have this balance between wanting to have our individual liberties and freedoms, which I think people are certainly entitled to, but also being wise enough to realize when it's in our common interest to work together. Let's raise the barn as a community. Let's put the steeple up on the church as a community, because one person can't do those things by themselves. And so, I think what we're talking about here in terms of community is something to me that's so much more basic than politics and is really ground in pragmatism, not ideology. That if I'm in my backyard and I'm trying to move a tree stump that's too heavy, I'm not going to double down on doing it by myself. I'm going to just be wise enough to ask my neighbor, Doug, if he can give me a hand. And if I'm reasonable to him, he'll give me a hand. And so it's that level of working together as a community that I think it's I think it's really easy to like label this as something. And it's certainly not anything other than, realizing that, the only way for me to have the only important influence on my child is for them to live inside my home, never go to school, never go to the grocery store, never consume media, don't listen to the radio, don't go online. I mean, at some level, we are all in this together when it comes to creating an environment in which, kids have a chance to really thrive. And so, it's that kind of very pragmatic, practical level. And I think one thing I really like about this approach is it has nothing to do with any kind of ideology beyond the ideology of how do we sustain adult attention over time and keep us really focused on the priority of making decisions that are in the best interest of young people. And by the way, applying them in very specific ways. So let's say the community, we say, well, so they run the data, they look at the risk and protective factors. And in that specific community, they realize, and by the way, some of these are all near universal truths, but you still want to look at local data and see what's most impactful. But they're like, man, really students in this school who report that young people, that it's safe to try your best in school. And that if you do, your friends won't make fun of you if you make mistakes, right? That it's socially okay to try your best at school and that it's a safe place to make mistakes. And a community can say, we want to set some goals around that. And there's a role for parents in that and how we communicate to our children about the importance of school and how it's okay to do your best. Let's encourage our friends to do their best. Let's not make fun of kids who make mistakes. There's clearly a role for that in schools. There's a role for that in peers. How do we teach peers to reinforce each other in a way that creates these safe spaces? There's a role for that in the leisure space in terms of after school programs, or, if I'm coaching a team and I say, hey, look, academics is important in this team. In order to continue being a part of this team, you need to be trying your best and working hard in school, and we need to have positive reports back. And so in this way, a whole community can come around what looks like a school related goal, but it's not. What it's really is it's a young person related goal. This protective factor is so important that we can all come together and kind of reinforce it together. And so it's really that kind of pragmatic teamwork that I think is so helpful in this approach.
Well, some of the things that I'm hearing and talking about teachers and building the capacity of the organization that serve youth and the youth themselves is the community, the importance of the community coming together to talk about their values as a community. You mentioned values earlier, and that word jumped out at me because it's so important. And what I'm hearing is a community comes together and say, hey, these are the things we value. These are the protective factors that we value. So let's build those up.
Yeah, I think so. And I think, it's funny because I'm not like I'm a little bit, I definitely have I'm a big hearted person, but I'm also not particularly let's sit around the campfire and hold hands. And, there's a balance to that. But I like how you described it. I do think there's so much value to us just being able, how do we create time and space for adults to reflect on how important our children are, not only individually, which I think a lot of us do as parents, constantly, but how do we do that together? I don't know that the spaces for that are as common as maybe they had been. And how do we create a space for that to say, hey, we share this common value. This is important to all of us. and then to be able to do something to act on that. And by the way, like not big things, little things, some example goals might be, things like you might find in the data that, and again, these are common things. They're very often scientifically, but you're looking for what appears most relevant in a community. They're all going to have some amount of impact, but you're looking for specific to that community. What are like the high leverage kind of things that we might be able to choose from? So say in a given community, what we're noticing is that young people who report that they're two things. One, that their parents know where they are, like pretty much all the time, and that they communicate effectively with their friends. The young people who report those two things really have low rates of substance use and abuse in that community. And so we might encourage family members to do things like, call up your child's friends, parents, or caregivers and spend time getting to know them. Or maybe set a goal that once a month you'll invite some friend of some parents or caregivers of your child's friends to your house, and you'll have a meal or you'll go to their house. Or something as simple as your child says they're going to spend the night with a friend. You just pick up the phone and call and check in and make sure that's really kind of what's happening. This idea of, kind of monitoring and co-monitoring together. And these all seem like super simple things, but these are also things that it's easy for us to miss as adults, especially in our super fast world in which is just, as much as being connected is important to us, there's a lot of science that shows that being disconnected is easier than maybe it's been in the past. And so, part of what this approach does is it does encourage us to make these connections in our community, but in like super authentic ways that, by the way, don't only benefit young people in terms of kind of creating this protective environment, but that often just benefit families and communities more generally. I would say one thing I really love about their approach is you build this capacity with the intent of reducing adolescent substance abuse, which is awesome. But then there's all these other benefits that we tend not to count, right? And in this case, it might be the benefits of more cohesive communities, or the benefits of knowing our neighbors better, or the benefits of being able to communicate with people in ways that maybe we wouldn't have been able to before. And then how do we leverage that to greater good? I mean, there definitely have been times in Iceland where people said, well, it seems we've kind of tackled this. Maybe we should disband it. And people are like, no, let's take the same capacity and maybe focus on things like youth quality of life or youth mental health or indicators related to thriving. And so, we can begin by doing things that prevent substance abuse, reduce substance abuse, but also that have a lot of, I think, really, that build the capacity in a community to have the kind of relationships and the kind of cohesion that not only create these great outcomes for young people in terms of that very narrow space, but that can then be applied to young people in other ways, and that also have just a lot of benefits to any adult that lives. I mean, these are the kind of communities I think not everybody, but a lot of people dream of, right? That we I used to live in a really small town, 450 people, and I tend to be a little more introverted, so I'm not one to walk down the street and have everybody stop me and ask me about my day and have a very long conversation about it. Like, I'll admit that limitation as a human being. But you know what? I love being in a town. When I walked down to the post office, we all waved at each other and we had some of those conversations, and you just knew that there was a certain amount of care and courtesy, and that if you had a problem, you could go to your neighbor's house and knock on the door, and that someone would be receptive and helpful. And so I think, community building, especially around the goal of being good for young people, is really at the heart of this. And there's just so many benefits to it.
There's two things that I would love to touch on as well. So I'm curious about the execution, the implementation factor. You've capacity building of the organizations that serve the youth. You've talked about your values as a community. What does it take to implement?
Yeah, I mean, I think that's a great question. And I'm going to try and not, we have kind of what we call our founding principles, the guiding principles, which we've talked a lot about. But then there are also kind of these 10 core steps of how you execute the model that I don't think this is the right environment to go through all of them, but I've definitely touched on them. This idea of how do we build a local coalition? How does that coalition develop some institutional capacity, maybe some initial funding? How do we engage community members and let them know, hey, we want to collect some data on young people to understand the environment they're growing up in, but we want to talk to you first. We want this to be something we do together. And how do we share that process so teachers and parents and other caregivers can say, hey, yeah, this is something that we're doing and we all want to participate in. There's an actual data collection process, including some data-driven diagnostics that, like I said, we envision a school as the hub of the community that serves a group of young people. So although this is not a school program, it's definitely a program in which schools are often a very important partner. We do everything in our power not to add to their burden because schools are already doing so much, but instead be a source of support for them where we're able to better connect them to families and other policymakers to support their work. But so they do some distribution and of survey instruments. And then we create a report that describes the neighborhood that school serves. So it's not the school itself, but it's like the school catchment area, and the diagnostics are very specific to that neighborhood or catchment area. We go through a process where we do a lot of reaching out to families and community members and professionals that serve youth and have dissemination meetings and try and disseminate findings in a lot of ways, sometimes through reports that are very graphic heavy and minimize the text and just make it easy for people to see what's happening in a community. We tend to have live community meetings as well as online community meetings where local folks, for the most part, can take people through the data and discuss, what are you seeing in the data? Is this consonant with your experience with young people in our community? And when we look at some of the risk factors we want to try and decrease or protective factors we want to increase, which ones are the ones that feel possible in this community, that feel consonant with our community's values, that are in step with where we're trying to go? And as a result, the community can really get behind them. I think there's levels of community level goal setting, and then trying to, once those goals are set, going to all these key institutions and stakeholders and saying, what are some things you can do to support progress on these goals? How might you align your policy or practice in a manner that is going to contribute to this community changing the environment together? And then, you really focus on letting young people be immersed in those kind of environments. And then you repeat the process again. You have the coalition take a look at what we're doing, get some more data. When you can see over time where a few things have changed. One is our rates of actual substance use and abuse among young people, but also how they're reporting risk and protective factors that we're targeting. Or are they saying that whatever our goals were, that they're reporting a difference from their perspective? And being able to look at both of those things gives us a real sense of progress, which I think is super helpful in coalition work. Just this idea that, because we are measuring, and when we do this, we generally try and measure the whole population. So, our goal is to have 70% better response rates, and we often have them in the high 80s or 90s. So we really have a clear sense of what's happening with all the students in this community, which is pretty undeniable. When you start to see those indicators get better, you get excited and want more. If they're not, it makes you rethink, did we really implement this like we needed to, and double down and either try harder or try something new? But so I think like those kind of, that I would say that's like, without going exactly step by step, those are kind of the bigger rocks in the process.
And is there a link I can put in the show notes for folks to go learn more about all this?
Absolutely. I can link you to a couple of PDFs, which I think are super helpful. And then I definitely want to, so there's kind of the scientific side of this. And then there is the Planet Youth organization based out of Iceland, who is comprised of many people who were very much a part of this work long before I've ever been a part of it, and who are making this available to people all over the world. And so, I would say that, they are the prime disseminators right now of this kind of work. And there are many other organizations doing good work all over the world around the Icelandic prevention model. But I, in terms of Planet Youth, really the people who founded this approach, also have founded that and just have unbelievably rich and important experience. And so, yeah, I think they kind of have two sides. They have a They certainly are service providers. Their goal is to, help people implement this. And so they have some free content on their website, which I think everyone should take a look at. And for those people who can think about, getting some of the other services they might provide, that's great too. But you're going to find tons of them being the good people they are. You're going to find lots of free stuff just designed to help people that are interested.
Beautiful, beautiful. Listeners, check the show notes for that link. And the last thing that is really on my mind as we're nearing an hour of conversation is sustaining adult attention. I want to learn a little bit more about that. How in the world do you do that in this era?
I think it's getting harder. I mean, I think that's an honest answer to that question. I think there are a few things, and these feel like subtle points, but I think they're important points. So I think there's an important part in how data is collected that helps. So some people will say, well, why do you try and survey a whole population? And instead of sampling is, you can get a smaller number. It's representative. Can you do a great job through sampling? The answer to that's yes. In terms of sustaining attention, I think this idea of trying to just, when I say population sample, I mean sampling all the young people in the community of a certain age. And usually we're looking at like middle and high school, is that there's something just super relevant about that. So what you're saying is I'm looking at data of the kids that are my child and all the kids sitting around my child. Yeah. So let's say you have a 90 or 80% success rate. Someone will say, we don't know anything about those two, the 20%. Well, that might be true, but imagine this, your child's sitting in class and you look at the 10 people around them and it gives us a vision of what's happening with the 8 out of the 10. Like, is that meaningful to you? And I think the answer to that for most people is yes. And so I think that strategy, this sense that we've gone out of our way to really hear what young people are experiencing from their point of view, and we're presenting it in a way that's incredibly accessible to the community at large, and that the people that are presenting it are trusted people in the community that gain our attention just by being the people who say it. You know what I mean? So for instance, like me as a researcher, I'm not going to present these findings. I mean, no one cares about that. I might help prepare them, and I might talk to community leaders about, what I see in the data, which is often not as important as what they see in the data. And then they're able to go and do this presentation. So I think this idea of really capturing the whole community or the vast majority of the community is helpful, because it makes it actually is very real and very representative. And it makes it hard to be like, if you do a survey and it's 1,500, even if you use great sampling, it's easy to say, well, maybe, that was just that 1,500. And what you never want to do is start debating, the virtue of random sampling at that point. It's just, it feels more relevant when we can say, no, this is really pretty much who's in our community. And so I think that is super helpful. I think this idea, and we've seen this so much in the past few years, especially around the pandemic. And again, I'm not one to cast stones because this stuff is hard. But I think originally my family's from Alabama, and oftentimes older people in my family might have the sense of the minute you start talking over my head, I stop trusting you. And, if you can't say it plain and straight, then what you're saying is suspect to me. And I think another thing that this approach has been really good at is, how do we present data in a way that's not going over people's heads, and it feels practical and relevant and real, in that anyone can use it to make decisions to help benefit their children. So I think this idea of thinking about how we communicate with folks is important. And I think the last thing I'll say is, I think this idea of, you mentioned the idea of culture earlier. How do we create a culture in which this becomes the new normal? So the gravity that often people face is we say, well, we're going to get together once a year and look at data, and most of the families are going to show up. In a lot of places, the gravity it would take to get everyone out, right? The incentives we would have to use, figuring out the barriers, or we're going to provide food, we're going to have childcare, we're going to get transportation. Like in the beginning, all of that feels like a really, really heavy, hard lift. But if people buy in and it becomes a part of the culture, then that just becomes the new normal. Well, every August, we're going to hear this data. Every August, we're going to reflect on how things are doing. Every August, we're going to have the bus pick people up and have food available and have childcare. And it just becomes like this thing that if we didn't do it one year, it would feel incredibly strange to everybody. And so I think that is part of it too, is, part of the way you sustain the attention is we create these traditions, showing up and doing this is like Christmas. You know what I mean? It's something we've set aside as is almost sacred to us to draw our attention to a value that's deeply important to us, which is our children and their well-being. And we're going to devote this time and energy to it. And then we're hopefully going to carry that with us throughout the year until, the tradition happens again. And so I think that is another really important part of it, of how we sustain it. We build it into the culture. It just becomes over time what we always do around here. And if for some reason it doesn't, we bristle at that and make sure it does. And I'm not suggesting any of that's easy. I mean, it takes a Herculean amount of work to break the gravity of what we're used to and get into a new pattern. But I think I think once you achieve that sweet spot, that's kind of what you're shooting for.
Absolutely. I had something witty I was going to say and I lost it.
You're awake. I'm just impressed by that alone. That's great.
So we should probably wrap this up. My last question, though, to close us out, is that if you were to tell our listeners, if you're going to remember one thing from this podcast episode, remember this, what would that be?
Yeah, I can boil it down to two, and I'll try and be brief. I hate to blow up the premise of the question, but I just think they're just so closely related that it's hard for me to even think about them as separate. I think the first thing I would encourage us of is that there are some things that are so important to us that we just have to work together to make them happen. It's okay to say, man, I care so deeply for my child and their friends and the children in this community. I can maybe change what I normally would do and work with the people in my neighborhood just to make a great neighborhood for the young. So, that's okay. I think sometimes we're at a place, especially like post a pandemic, that has people weary and on edge and suspicious of making a sacrifice for somebody else. And what I would say is, let's not lump everything into one category of suspicion or fatigue, and instead just realize that there's some things that are just essential to us. And certainly, being able to join together to do great things for kids is one of them. And then the closely related second thing is that being able to sustain our collective attention over time. And although I do think, I'll talk about the States, I do think the United States makes great investments in children. I'm not trying to say that we always fail to put our money where our mouth is. But I would say that the way we go about it often interrupts and breaks that attention, and sometimes falls short of providing the resources necessary to get something done. And so for us, not only to sustain attention in terms of us as individuals in a community, but to create the institutional capacity to have some organization be able to, maintain the capacity they need over time to solve generational problems, I think is really important. So, what's the 1-2 punch? One is us being able to say there's some things so important that of course we're going to work together, and children is definitely going to be one of them. And I think the other is to say, how do we express that through sustained attention and strong institutions that are able to get the job done that we know is super important to us? And those are both really hard things, but I think that's, what we're pulling for.
Yep. And like you said, when you got to do hard things, got to do it together.
You got to do it together.
Well, this has been awesome. Awesome. I could sit here for hours and pick your brain and talk, but I know we both have a lengthy to-do list because we're some go-getters. So I will thank you very much for taking time out of your busy schedule to share your wisdom with me and with our audience across the globe. I will put links in the show notes for y'all to be able to learn more about the Icelandic model and Planet Youth. Keep up the great work, Mike. It's been an honor.
Oh, thank you so much. And I'm a very small part of this. So grateful to the people who've done most of the work, and grateful for you for setting aside time to talk about this and just share, a little bit of what's made a difference in the lives of a lot of young people. So thank you very much.
That concludes this episode. Thanks for tuning in. Be sure to hit the subscribe button and share this episode with a friend before you leave. And we look forward to seeing you on social media, because prevention is better together. Together, we are stronger.